Hi, Karishma. Karishma is also joining us. Hi, Elizabeth. That's much better now. Greetings and welcome to the preparatory meeting of the Europe-India Digital Health Summit. Hello, Caroline. Caroline Perrine, is so great to have you here. Good to have you here. Great. So, oh, and George also joining us from the US. So this is really becoming a global meeting. Welcoming George. Matthew, we just have the pleasure to be in the Infarmed facilities in Lisbon. Infarmed is the national authority of medicines and health technology. It's a great pleasure for us to have their support on this. Hey, and Caroline Perrine is also joining us. Hey, from Geneva. Hello, Caroline. Good to see you. It's great to have you here on board. So I think that without further ado, we can start the call. Hey, George. Good to have your smiling face with us from the US. Amazing, amazing. So I think without further ado, and this is being recorded, this meeting for anyone not be able to join. Oh, and Eric Sutherland as well joining. Let's welcome Eric. As we initially have a lot more registered participants than we are having in the room, but for the sake of our time, which we respect the most, and now we have to have a hard cut in 90 minutes. And Bonnie has to leave us in 30 minutes. What I propose, and Lance Owen, also from the US, welcoming Lance Owen from the US. So this is becoming really a global meeting, hybrid meeting, live from Infarmed. Hey, Lance, good to see you, and welcome. I think on the sake of time, as I was saying, as Bonnie has to leave us unfortunately in 30 minutes. She's required in the Ministry of Healthcare in Portugal for another visit. We are going to take the chance to listen to Bonnie's presentation. And then on the remainder of the hour, we have time to introduce ourselves and go deeper into the goals of this preparatory meeting to discuss how we could be effective in this World Health Assembly side event that we are planning in Geneva, with the support of the GD Hub and Caroline. It's great to have her here. So without further ado, as I was saying, I would like to introduce you to Bonnie Clipper. Bonnie is a well-known influencer in LinkedIn, as she has accomplished a difficult mark on LinkedIn. This is considered to be the 22nd top voice in health in LinkedIn. She is a trailblazer in nursing innovation and a leading influencer in healthcare. Bonnie Clipper has been at the forefront of transforming the nursing profession through technology and forward-thinking strategies. Her career journey includes pivotal roles such as the inaugural Vice President of Innovation at American Nurses Association, where she develops strategies to engage millions of nurses in the innovation space. Welcome, Bonnie. It's a pleasure to have you here, and over to you to kickstart our meeting.
Excellent. Thank you very much, Paul. Muito obrigada. I'm going to go ahead and share my screen here so that we can actually tee this up with a conversation about what's going on in terms of the impact of digital health on care. So I'm just going to give us some food for thought here as we really think about what we can do together at the larger meeting, and things for us to think about today as we talk about planning. Okay, so let's start a little bit by thinking about what's going on in healthcare globally. We are all experiencing workforce supply challenges, ups and downs. We see dramatic gaps in nurses and physicians, and we produce more, and then we see dramatic gaps. We're also seeing changes in where care is being provided, a very, very rapid adoption of technology, not always smart investments or not always investments that are prioritized well, but we're seeing a rapid adoption of technology. Financial pressures only continue to increase, whether it's hospitals and their shrinking margins or government entities providing healthcare to their citizens. We're seeing that finances are going to continue to get more difficult, not more generous. And then in the startup world, in entrepreneur world, we're actually seeing that there is a tightening of funding that is available to startups. It's not drying up entirely, but it's certainly much more difficult to come by. So I want to start a little bit by giving you something to think about in terms of the greater lens here. And because I'm actually a nurse by training and a hospital administrator for 21 years, my lens tends to be the lens of the workforce. And what I see is very concerning. It looks like we will continue to have an increased need around the world in terms of different professions. So based on the World Health Organization, we are actually looking at a shortfall of around 10 million healthcare professionals. And when you think about that, that's actually coming upon us very, very quickly. India alone is short 600,000 physicians. So when you think about those numbers, there aren't going to be enough humans to do the work. So we really are going to need to think about other means to help support us or act as force multipliers to help us deliver the care. What you see in the right corner is just a little snippet here. And this is actually from the NHS from last winter. And the NHS sent out a bulletin to all of their ambulance crews saying that you're going to be waiting a very long time, even with a very sick patient having a heart attack or having a stroke in the back end of your rig. And the reason for that is that we actually are so short-staffed in our A&E departments that we can't help to offload patients fast enough. We realize that that means that some people are going to get worse, or maybe even some people are going to die, but there's nothing that we can do about it at this time. So when you think about it, this is us finding ways to normalize the fact that we are going to have significant gaps in healthcare professionals. So the reason that this is so important to us is that without enough doctors, physicians, without enough nurses, we are going to be extremely challenged to keep our countries well, to provide access, to provide preventative care, to provide acute care on not only a local basis, but a global basis. This was some data that I thought was very interesting. And of course, nursing is very near and dear to my heart. But when you look at the number of nurses that we have in mass, and over 50% of the workforce is comprised of nurses, there is a very, very large gap for us to make up. Over 7 million nurses are going to be needed by 2030. That's a huge number. So again, part of this is having you think about how we can use technology not only to disrupt what we do, but also to help us deliver care in a very, very different way going forward. I also want to challenge you a little bit on the models of care. We know that they're changing very, very quickly. And this is from a global perspective. We tend to be moving away from sick care more towards healthcare. We're also looking at healthcare when it used to be episodic. It's becoming continuous, finding ways to provide preventative care and helping to care as a holistic person. However, we run the risk of this being completely disrupted, because if we don't have enough people to deliver the care and we can't use technology to help us, we actually are going to break the chain and we won't be able to provide continuous care. So these are some of the things that we have to think about as we all come together. We're also at a time where there are a lot of benefits and a lot of opportunities that we didn't have even a couple years ago. Care can be delivered virtually now. Care is much more personalized now. In areas that certainly can afford to provide customized care, we can zero in on cancer treatment modalities that are specific to the person all the way down to the gene. So what we can do now is incredibly different than what we did years ago. And one of the things that I find the most encouraging out of all of this is that artificial intelligence is going to provide us with tremendous opportunities. We don't even know what all of those look like yet, but it will have the ability to improve access, to reduce disparities, to reduce the cost of care, and to help leverage the technology to act as a force multiplier for those of us that are in the healthcare workforce. One of the things that we're seeing evolve is delivering care in the right places. And acute care used to be our predominant model. It used to be when we would send a patient, a community member that was sick or in need, we would actually admit them to a hospital, to a brick and mortar hospital. Those are the most expensive places to deliver care. So we are seeing a decentralization of that model. And I don't think that's a bad thing. I actually think this is a very good thing. So it's going to be a shifting of where we need our workforce to be distributed. We're moving, certainly in the US, we're moving more into home care and clinic and outpatient care. However, in Europe and in India, you are actually ahead of us in that there is a public health system and a home care system that is in place. Now, they both need to be bolstered and supported. We need to use technology to improve the quality and the outcomes and reduce the cost associated with that. But we already have some structures in place, so we're not starting from zero. There's a couple technologies that I just want you to think about a little bit today as we talk about how can technology support healthcare. It isn't intended to replace healthcare providers, whether it be a physician or a nurse, but rather to support, to supplement, to complement. That's the way we have to think about technology. And of course, technology isn't cheap. So we need to really think about what's the goal and what's the problem that we are trying to solve. There is tremendous opportunity as we think about the utilization of predictive analytics. This really opens up a whole new world to us. Everything from helping us with diagnosis, prognosis, treatments, quality of care, reducing cost, reducing disparities, improving access. This is a whole new world. So we're going to have to find ways to get better at accessing data and using the data to tell us a story that allows us to do something actionable. When we do that, we have to also reduce the cost. All of these things cost a tremendous amount of money, and we're going to have to get much more effective at how we can utilize data to model and predict and give us future outcomes. That's a challenge that we're going to have to figure out. When we think about artificial intelligence or augmented intelligence, we really don't know the impact yet, but it's vast. It's going to be incredible. Everything from how it can help medical professionals, healthcare professionals, physicians, nurses, therapists, to how it's going to help patients. Even patients alone will be able to utilize AI to assist us with analyzing data from wearables. Think about all of the data that sensors can pull in. No human beings exist to sit down and parse all that data, to literally analyze it and look at what that's telling us. That's one of the very strong use cases of AI. We also can use AI to help us from a chatbot, a patient education perspective, triaging and screening patients. Do you really need to have a physician visit? Could you have a nurse practitioner or a midwife visit instead? So helping us reduce the cost of care while improving access is going to be incredibly important. And then certainly think about everything it can do for physicians around radiology interpretation or imaging interpretation, designing treatment plans that are custom to the patient. We all struggle with documentation. So generating clinical notes or clinical documentation, there's a tremendous amount of opportunity. And then in the US right now, Microsoft and Epic have partnered. So we're really seeing some very strong outcomes around some pilots there to begin to reduce the amount of documentation that happens simply by using speech recognition technology coupled with AI. So there is tremendous opportunity here. Hospitals are actually becoming smart. While this is incredibly expensive, we have the ability to utilize LSE or RTLS to track a patient from the moment they're admitted to the time they leave the hospital. We will know exactly where they are. Are they in the operating theater? Are they in A&E? Are they in a patient room lying in their bed? We will also know where every physician and staff member is at all times. More importantly, though, we'll have the ability to track our patients on physiologic monitors. Typically, what happens today, if you're in a critical care area, we would put the leads on you and we would know exactly where you are and what your physiologic rhythms show. However, if we take you down to an imaging for a procedure or to the operating theater, we have to unplug you and put you on a portable monitor. In a smart hospital, we would be able to monitor you no matter where you are in the facility. These systems also can tell us who's coming in and out of the room, who's visiting. Are people washing their hands? Are people giving bedside reports? We would know if a patient is being turned or moving. We would know if a patient is going to fall. We would know all of these kind of things. So while this is amazing, on the back end, it still is going to require humans to help analyze and evaluate this data. And again, that's going to be one of our challenges with technology adoption. This is ambient computer intelligence. And in the United States, we already have several hospitals that are utilizing this. We mount speakers, cameras, sensors in a patient room, and we actually can utilize AI to determine if a patient is getting out of bed. Are they supposed to be getting out of bed, or are they going to fall? And again, we can monitor and track our patients. So this technology continues to have an increase in the use and the application for us. But our current systems aren't ready for that. So we need to think about how we're going to prepare our workforce to leverage them and utilize this technology. Hybridized care. We are seeing this become the fastest growing care model. And the applicability of a hybrid care model is globally. And basically what this means is that we have the ability to have a nurse on the pop-up on the television or a tablet or a mobile cart that can provide support, education, advice to the patient and the nurse in the room. So if you think about it, this is a two-sided care model. We have a direct care nurse or therapist or physician that's in the room, touching the patient, talking to the patient. And on the screen or tablet, we can actually have a physician, a social worker, a nurse, someone to support that work. So the two sides of this represent a hybridized care model. This has now become the fastest growing care model in the United States, particularly in acute care inpatient settings. And this might be a way for us to actually increase the scope of what a nurse cares for in person while providing them with extra support and supplementing them, offloading their documentation, doing patient education, observing a critical patient, talking to family members, orienting new nurses or new physicians. So it has tremendous applicability to us. And again, on an international level, I think there's a lot of room for this to expand and grow. RPM or remote patient monitoring. This is something clearly that's growing very, very quickly as well. The ability to monitor a patient, their blood glucose, their temperature, their blood pressure, their weight. We can monitor a variety of different biometrics from a patient's home and send it into their care provider, whether that be a physician or a nurse practitioner. And then will that help us to provide care for someone in a rural community so they don't need to come in and visit the provider? Can we then give them that care in their home? Will they have the ability to receive a prescription or a treatment or a medication so that that patient doesn't have to drive an hour or 2 or 3 to come in and see a provider, but rather can stay in their home while they're receiving care? So again, tremendous opportunities for us to think about how do we create the care models that incorporate this technology. And we think about, while this sounds like George Jetson, we actually think about how do we use robots? So these are all robots that are utilized now in different healthcare settings. The one on the far left is actually Moxie. Moxie is a hunter-gatherer. So hospitals deploy Moxie. And what Moxie will do is go to the pharmacy for you, go to the cafeteria for you to get food for your patient, pick up medications in the pharmacy, pick up supplies for your their patient and bring them back to you so that a human being doesn't have to do that work. And what we're seeing is that hospitals that are utilizing Moxie in the pharmacy, they're able to free up those 3 or 4 pharmacy staff. And now they're being trained to be surgical technicians in the operating room or nurses. So it gives us the ability to offload the non-value added tasks and instead upskill those workers so they can do something much more important. Then in the other 2 pictures, you really see our robots that are utilized for behavioral health or even to avoid loneliness, if you will. The bottom one is being utilized for senior citizens, and it talks to them a couple of times a day to ask them how they're doing, and their answers are all recorded and analyzed. It reminds them to take their blood pressure or their heart rate or their glucose or their pills, and then it documents that. So we're seeing more and more deployment of these kind of robots, and Japan is actually one of the leaders in this space right now. And then if we look at the child and the robot, this is another mental health robot. And what this robot does is it focuses on kids that have autism or special needs or learning disabilities, and it can speak to them, and it does a little bit of therapy with them as well. So this is yet one more way to help us really increase technology to be a force multiplier, to accomplish things that we don't have enough human beings to do anymore. These are some emerging tools that are being utilized by clinicians. So on the left, this is really not that fancy and not that new. This is just a Bluetooth earpiece. What we are seeing is more hospitals are deploying that earpiece to allow therapists, physicians, and nurses literally to dictate their notes through a speech recognition technology, and it will then document those in their electronic health record. While it doesn't seem very high tech, it is a time savings. And we know right now that about 36% of the time clinicians are documenting. That's the top cause of burnout. So we really have to figure out ways to eliminate literally typing at a keyboard and documenting. But instead of offloading these tasks, we have to simplify the workload. Then what you see in the middle here, these are really neat. This is actually a wound care tool, and these are glasses that are thermal imaging glasses. So if you were going into a patient's home or an outpatient setting, you actually could assess how large, how deep, how many cavities a wound has. It will transmit that data perhaps to a wound care physician or someone that could help you develop a treatment plan and then care for this patient. So again, this could help you keep patients out of the hospital, but rather care for them in their homes. And we know patients much prefer being cared for in their homes over coming into the hospital. And then on the far right, you actually see a stethoscope. This is gaining a lot of adoption in the United States right now in medical schools and nursing schools. This is the Echo. So the Echo is literally a smart stethoscope. It's Bluetooth, Wi-Fi, noise canceling. So it literally allows you to focus in on the anomalies or the sounds that are different, that are wrong. And it allows you not only to isolate those sounds and hear them more clearly, but you can visualize the waveform, which makes it easier to understand what is going on with the patient. And you can save an MP4 file of that and upload it into the patient record, or you can save an MP4 file and send it to a consultant that's maybe in a different state or different country to actually listen to what you're hearing and what's going on to validate that. So these are all ways that we can continue to extend what humans do on the ground with the patient and send it back to others that might have a larger scope of patients that they're caring for. Finally, I think it's important for us to also consider when we talk about workforce challenges, there are not enough faculty to help us grow new nurses or new physicians or new therapists. So that too is a challenge for us. We have to find ways to leverage that. And one of the things that is gaining adoption, although it's very slow, that's virtual reality. And of course, what virtual reality does, or the metaverse, what those allow us to do are to create virtual assets that help us through critical thinking and problem solving. And when you couple that with the handpieces, with the haptics, it provides feedback about right or wrong decisions. And this is a great way to teach upcoming professionals, because what it does is it actually helps the education to last 7 times longer than it would in the traditional education or academic way. And why this is important is because we also have a faculty shortage. So growing more healthcare professionals is incredibly essential to us, as well as finding ways to leverage them even more by offloading the things that humans don't have to do anymore. Wearables and sensors, this continues to grow. And while I think there's a tremendous opportunity here, I also think this is one of the things that could drag us down a bunny hole if we're not careful. So what you see here on the top right and left, this is actually a way to not only monitor your glucose, but also it autonomously provides the insulin through a tubeless insulin delivery system. And if you look at the bottom two corners, what you see on the left is actually it's called a puck. It's a vital sign gathering tool. So it actually gathers temperature, heart rate, and they are working right now to get FDA approval on blood pressure. But imagine what that means in hospitals if no one has to take a blood pressure anymore or vital signs. That frees up a tremendous amount of time. Now, the downside of that is it's continuous data. So once again, this is where we could utilize artificial intelligence to help us figure out how do we get a snapshot of the vitals of these patients instead of just getting billions and billions and billions of data bytes that we're never going to use. On the lower right, this is fascinating. We're using this in a lot of hospitals in the United States right now, and this is for patients that have a difficult challenge turning and repositioning themselves, and we're utilizing it to prevent the very expensive problem of hospital-acquired pressure injuries. Those are incredibly expensive and very painful and very challenging for us to resolve once a patient develops that. So by knowing in advance who needs to move and how much they need to move is incredibly helpful to us. There are also a tremendous number of growing platforms and apps that are patient-specific, whether it's the one on the left that's digital twins. It's creating an avatar to have a conversation with a patient. These are used right now for screening and also patient education. And you'll see the other apps here on the screen allow patients to pay their bills, to schedule appointments with their physicians, maybe even schedule a pre-admission lab process or an imaging X-ray with a hospital or with a provider just on their phone. And part of the reason we're doing this is, of course, patients continue to grow in their world of being a consumer and are very used to utilizing a device such as their phone or tablet to make those appointments right now. So giving them the ability to do that in a safety, high secure, encrypted, and private way is something that's going to benefit all of us. The other thing that's important to think about is while that there is a shortage of healthcare professionals, there's also a shortage of office staff to support those professionals. So if we can offload some of these very mundane activities, while they're very important to do them well, let's take a look at what technology we have to assist us in offloading those functions so we can continue to pull the human beings up to the top of their ability or the top of their capacity. So just to sum this up, I really would love to kind of leave this with you in terms of technology. There are a million shiny objects out there. And I think we always have to have caution about chasing the shiniest, sexiest, brightest technology. And instead, I would offer you a framework. And the framework really needs to be mindful of what are the basic things we need. So think about Maslow. We want to talk about what can we offload that's more low risk. Are there ways to do billing, pre-authorization, scheduling, appointments, things of that nature? That's a good place to start to build a foundation. And then move into speech recognition technology, virtual care, chronic care management, things of that nature. And then certainly after we get all those pieces in place, maybe down the road in a couple of years, as we continue to develop this whole paradigm, what are the opportunities for therapy, diagnostics, imaging, et cetera? We know that the challenge is that everyone only has so much money to spend. Whether you're a hospital or a health system or a government, there's only so much money. So how do we begin to prioritize what our needs are and make sure we adopt the right technology? So in the spirit of workforce challenges, just giving you something to think about as you continue to move through your conversations today. Start with administrative tasks, simplify documentation, and find ways to streamline workflows. Generally speaking, this is the safest entry point to get into and to continue to grow from there. Thank you, Paul.
Thank you. Thank you so much. It was so interesting to have this opening for our preparatory meeting, and I would like to acknowledge newcomers to the meeting, and also to say goodbye to Bonnie, as she has to leave in a few minutes. So unfortunately, we don't have time for quick questions to Bonnie, as she's pressed for time now for the other. IAF, National Association of Facilitators. Good afternoon, Sue.
Good afternoon, everyone.
And thank you, Sue, for assisting on moderating the Knowledge Cafe. We're going to start right now. This will be an opportunity for each one of you participants to become speakers, right? So we're going to create 3 series of breakouts with 2-3 participants each. And you have the chance to talk and interact among each other. Sue will give further instructions about this, and we'll reconvene in the end with the panel by our dear co-chairs also joining here today, Professor Rajendra Gupta and Steve McFeely. Thank you so much, dear co-chairs, for joining, as well as a guest panelist for today, Jennifer Punyet. Thank you so much, Jennifer, for having us here. Unfortunately, Eva Aurin is not able to join, so we're going to have 3 panelists in the end. But that said, we're going to have plenty of time for interactions in the Knowledge Cafe, and over to you, Sue.
Okay, thank you very much, Paul. And again, welcome to everybody this afternoon. And yeah, it's good that I think we've had this introductory presentation from Bonnie. Thank you very much. Very informative, very interesting. And it's the chance now for all of us to contribute to this discussion. Let's remember the context we're working in. So this is a preparatory meeting for the Europe-India Digital Health Summit, which is coming up in May, and which will sit alongside the Global Health Assembly. And that itself sits alongside, of course, the WHO, the World Health Organization, meeting to take place in Geneva, where the WHO is based. So, you know, our work this afternoon is going to prepare the ground for that meeting in May. And I suppose what we're thinking about is how we can contribute to that process. What are the issues which are important to us in Europe-India cooperation? And, you know, I know there are representatives here today from Europe, great from the US, other parts of the world, also from India. So what are the issues, you know, that we are thinking about today in terms of digital health, which are going to contribute to discussions at the summit? And we'll issue maybe some recommendations for action. Maybe we're thinking about influencing policy, for instance, government policy. Maybe we're thinking about legal processes, the law. Maybe we're thinking about funding. You know, we're going to be looking for, all of us in the medical world, digital. We look for funding, do we not, to enable us to match our ambitions, both in terms of research and development, and particularly in digital, looking forward, but also in implementation. So, you know, there's a number of areas where we need to think about how we move forward in digital health. And before we go in, Paul, to these groups, I'd just like to recall a number of points that Bonnie made, and 1 or 2 others as well, which are relevant for these discussions and relevant for highlighting these issues, which should be clearly identified and put forward to this summit in May. So Bonnie drew attention to particularly the shortages in funding, shortages in staff, therefore the need for more technology. These points points are in no particular order, but stuck out to me as being important. The importance of hybrid care, the use of virtual reality in terms of having virtual nurses or virtual clinicians alongside physical nurses or clinicians, the use of avatars, maybe chatbots, and the importance of remote monitoring today, being able to continuously monitor health, and in a promotion of well-being context as well, a preventative approach, for instance, which ensures monitoring of health on a continuous basis, both probably healthy people as well as unhealthy people, whatever we mean by unhealthy people. Service robots, the use of robots in the context of administrative tasks, in the context of the elderly, care for the elderly, treatment of documentation, the use of AI to sift all sorts of documentation, all sorts of information coming forward. The use of wearables and sensors, again, the link to virtual reality. And the important point of using technology to enhance the challenges at work, and particularly in this case, the health profession. And then the issue of a broader, more generic issue here, which you might like to think about, and that is, how do we ensure universal care, which is affordable and is quality in the area of digital health, but which also avoids a digital divide, so that we don't have for reasons of finance or reasons of geography, we don't have certain health seekers of health advice and seekers of healthcare going on the one hand being able to access, but then others not being able to access for different reasons. The importance of education that Bonnie and appropriate education to be provided in terms of preparing for the digital health for the future, but also how learning is undertaken. So the actual use of the technology for healthcare, but also how learning is undertaken. In other words, the technology used to learn. Disease surveillance, data governance. How do we govern data produced in the area of health? What are IPR, intellectual property right considerations here? So yeah, those are really some of the points I think that we could do with working on this afternoon in our groups. And remember, that we are contributing to this health summit, and we are thinking ultimately about how we want to influence the way these technologies develop going forward. Do we have an anchor somewhere? Do we have an anchor technology? Do we have an anchor issue? Is there an anchor stakeholder that we need to make sure is well included and highlighted as an important contributor? And again, in terms of public, because we're talking about public policy here, public activities. Is it policy? Is it legislation? Is it funding? So, Paul, I think I hope I've brought together, and I hope I haven't been too long. I'm sorry.
No.
Or a number of the issues, and maybe what we're pointing to in terms of issues that we recommend, with issues that we highlight this afternoon, which may lead to recommendations later on.
Absolutely. That was a
Thank
great
you.
summary. It's a great summary of Bonnie's starting keynote. And now we're going to open the breakouts group. So you'll be automatically invited to a breakout room. So we are relying here on the technology to randomize your interactions. We're going to have 3 rounds. So hopefully you will be able to talk to each other in the room on a secured environment, like 3-4 participants. You could start to address the questions here Sue raised, and obviously introduce yourselves to each other, because that's part of being here, to know each other as we start this journey towards Geneva in May. And then we are going to send warnings about the time. So you're probably going to complain, oh, it's too short time, but that's part of the knowledge cafe method. So it's a series of interactions here. And then in the end, we'll do a wrap up with our guest co-chairs, and acknowledging also Enrique Martins is joining the group. So in the end, we'll do a panel discussion, a brief panel discussion, and we'll finish the planned hour. So without further ado, the floor is now going to be to you in the breakouts. Please accept the invitation for the breakout, as they will be automatically open for you in a randomized manner. You're going to be surprised with whom you find in the room, but that's part of the methodology. Enjoy the Knowledge Cafe.
But also what the skills of those staff will be required. So I guess we're looking at human capital, and is it artificial intelligence or or augmented intelligence? You know, those are some of the big questions, both for estimates and for the actual practice. Thanks.
Okay, thanks, Steve. Well, there seems to be quite a dominant theme so far then on data governance, and accessibility and privacy concerns. So that's good in itself. We have an emerging theme that can be taken forward. And finally, I'm going to hand the floor then to Rajendra, Professor Rajendra Gupta from India. I had the privilege. No, is that not correct?
Yeah, Sue, sorry to interrupt, but maybe I forgot to mention that Enrique Martins is also a co-chair, is joining the meeting. So perhaps you pass the floor to Enrique and finally to Rajendra.
Yeah, okay, that's fine. Yes, Eric from OECD, because I was with him just now. Where's Eric?
I think it's a different Eric.
No, it's Enrique, sorry.
It's okay, Sue. Here in Starbucks
Enrique,
in Manila. It's in Starbucks here in Manila. I am Eric, actually. So my name tends to move around the world in different ways and shapes, but you said it very well. It's the origin is French and it's a Portuguese name. Anyway, yeah, well, I ended up hearing Stephen's report. He was in all my sessions, so I have no further words, but I do add one or two that he mentioned that I want to develop. One has to do with this sort of augmented, or I tend to call it in my sessions, mixed or hybrid intelligence. For me, the big challenge, I like the split between data sharing and data collaboration. I think we should, in the scope of this summit, we should explore this idea. Because many times when you start talking about data between two big blocks, people get nervous. Whereas if we split the word immediately and say, of course, sharing might be an issue, might be interesting, might be on the roadmap, but why don't we just talk about collaboration to start with? Then I think people will lower their defenses. So I wanted to highlight what Stephen said and put it to use for our summit. I liked it, this sort of sharing is one thing, collaborating and sharing how you do it over there, and then maybe we'll do it together one day. And then on this intelligence part, I am now my big passion is how much intelligence can we augment with the artificial one in the humans? Because I've been teaching all sorts of people, students of all sorts, and medical professionals, but nurses and others. And for me, the big challenge for healthcare is, can we use AI to finally have, the best brains back? Because at least in my country, and I think in many countries in the world, we are losing the best brains to other sectors. And I wonder if that's not the biggest threat to the sustainability of the health systems. Is, health systems run by not a good set of brilliant people. We have never had that. That's the only thing I know how to say. We have never had that. We have had always very, very talented people going into healthcare. And that's been changing in the last maybe 10 to 20 years. And I wonder if AI can sort of boost that type of intelligence for more collective. So those are my reflections to add on. Rest, I agree, of course.
Thank you, Henrik. Yeah, it just occurs to me, one point you were making there in terms of data sharing or collaboration and the difference between the two, and some nervousness perhaps between between Europe and India. Interestingly enough, one of the groups I was in came up with the idea of a health data agency, who would an agency which would monitor use of data in the digital health realm. And I suppose if you had more confidence as to the state of play, the baselines, in terms of how you would potentially collaborate or share, that may make trusting each other to be able to collaborate and or share easier, if such an agency were in place, for instance. It's just an idea. It's just an idea.
Yeah. I mean,
Yeah,
on that, just a
WHO.
quick reaction on that. One thing that helps is when you know what the other ones interpret as a data agency, right? As a data governance. So one of the things that we've been learning in the EU, in this case more specific, is that when we sort of outline what are the competencies and expected capacities of what are called the digital health agencies, that creates more trust. So if, for example, between the EU and European Union in general, but also European countries that are not from the EU, they know how India and Indian authorities organize their governance,
sure,
and vice versa, of course, then we are at a better stage to sign sort of bilateral efforts and collaborations and things like that.
Okay. Yeah, that's good. Paul, am I in order now to pass the floor to Professor Rajendra Gupta? Yeah? Okay. Rajendra, the floor is yours. Thank you very much. You're the last. You're going to tie everything up for us today. So look forward to what you have to say.
The best part is everything is said. That only thing will be easiest. But I like the way this entire knowledge cafe was organized. Short, crisp, great discussion with people. I had Sue, I had Louis, I had Elizabeth, I had Lance, Prakash with me. Key points discussed. Standards are important. Interoperability without safety is not going to work. We need safety and security. You don't want disparate systems to talk and still expose themselves to, the loopholes. Then what about the organizations and countries with low income? Like what kind of technology you need? You don't need high intent, so maybe conversational AI, the chatbot with AI. So I think very interesting set of discussions, but all should be patient centered. And as I think Steve pointed, WHO is the organization to look at. I'll stop here.
Thank you very much indeed, and I think it remains we're very much on time. Thank you very much for everybody's contributions this afternoon, for speakers, participants, our contributors towards the end. And Paul, I think it's for me now to pass the final word to you before we sign off this afternoon. And just to say from my side, on the basis of these rich discussions this afternoon, I would look forward very much to the next stage, and eventually to producing even richer discussions, which hopefully will lead to actionable points in due course associated with this summit that we're going to hold in May. So to you, Paul, thanks very much.
Thank you. Thank you so much for your brave leadership in this moderation and discussions and summary notes. Thank you so much, participants, for joining. I feel honored to have here a group of renowned thought leaders, and there's lots of thought leadership in this group. And believe me, our goal and our intention are that we start as a community towards our side event in May. And then toward our major events happening in Mumbai, the 4th and 5th October, the Global Digital Health Summit, and then our event in Cascais on real world evidence. This is a joint collaboration between several organizations that are using this side event in Geneva as a springboard event to our conversations. And hopefully, if this is successful, thanks to our supporters, we can have a community that will keep on year after year, because the WHA is a major health event, and digital health needs to find more and more space in that conversation days in Geneva. Thankful, obviously, to Steve McFeely, Director of Data Analytics WHO, for being here and supporting this with his leadership and presence. Thank you also, Jennifer, for your support here. We look forward to have you also in Geneva in May. Thank you, dear participants. And as I said, oh, Enrique is back with the video on. Enrique, thank you for joining us from Manila. And so a conversation will start. You will receive a calendar invitation for exactly 1 month, and we'll see how we are progressing with our notes or discussions. Oh, I also need to acknowledge here someone really, and I think bring to the spotlight here, Caroline Perrine from GD Hub, which has kindly offered a beautiful space on the Tech Hub in Geneva. We're going to have physical space to meet on Wednesday 29. This is going to be a major update. So Caroline and GD Hub, we are so thankful to you and your inputs. Perhaps even you like to give us 30 seconds?
Sure. Hello to everyone I haven't met. I think I had different people in every room, so I met most of you. As mentioned, so we are organizing on the 30th of May a day that's called Geneva Digital Health Day, where we will have 5 blocks with different thematic areas. And we are also trying to integrate some of the discussions we will have the day before in this day. But this day has been organized since a long time. There are a lot of different organizations participating. And then we have, so on the 29th, we have still space in one of the rooms at Campus Biotech that has a capacity of around 70 people to host a get-together for the summit. So as most of you know, WHA is very busy in Geneva. I have the feeling this year it's even busier than the other years because there's a lot of different big events happening, the Research Forum, AI for Good, and so on. So it's not so easy to find a bigger space, but we hope that this will help to kind of bring the group together and start the summit.
Thank you so much, Caroline. So goodbye, everyone. I will kindly ask co-chairs to stay a little bit for the briefing as agreed, and then we'll see each other in a month virtually. Thank you all for joining.
Bye, everyone.
Bye,
Thank you very
everybody.
much.
Bye-bye.
Thank you.
Bye, Sue. Bye.